My name is Lynn Johnston, and this is my medical terminology pronunciation and use assignment for the spring medical terminology course. My discipline interest is in physical therapy, and I will be reviewing my 10 chosen words by pronouncing them and using them in medical sentences. So, what is physical therapy? Physical therapy is a healthcare field dedicated to assessing, identifying, and addressing issues related to movement and physical function. Physical therapists assist individuals in healing from injuries, coping with chronic illnesses, and enhancing their mobility through manual techniques, therapeutic exercises, and patient education. So here are my 10 words that I will present as applicable to the PT discipline. So first, we have range of motion, which is full movement potential of a joint measured in degrees. Here's an image. An example is the physical therapist assessed the patient's shoulder range of motion before creating a treatment plan. The next one is gait, which is a person's manner of walking. We have an image of gait analysis that will actually be learned in PT school. And an example sentence is, after hip surgery, the patient demonstrated an abnormal gait requiring balance exercises, which is pretty common. Third, we have hemiparesis, which is weakness on one side of the body, often due to stroke or neurological injury. And here's an image down here of someone having weakness on the right side. An example is the patient exhibited hemiparesis on the right side following a cerebral vascular accident. There's a lot of patients at a PT clinic I used to work at that had this issue. The next one is proprioception, which is the body's ability to sense its position and movement in space. So here's an image of someone trying to sense. And an example sentence is, standing on a balance board helped improve the athlete's proprioception after an ankle sprain. The next term we have is atrophy, which is the wasting or loss of muscle tissue due to inactivity or disease. Here's an image of a normal muscle and then a muscle with atrophy, a little bit smaller. So stretching and positioning strategies were used to manage the patient's spasticity. Oh, that's the wrong one. Excuse me. The patient experienced quadriceps atrophy after weeks of immobilization in a brace. My mistake. And the last one is spasticity, which is increased muscle tone or stiffness, often resulting from neurological damage. So the example sentence would be, stretching and positioning strategies were used to manage the patient's spasticity after their spinal cord injury. This is common with paraplegics. The next is edema, which is swelling caused by fluid accumulation in body tissues. Here's an image of someone's swollen foot. The PT used compression and elevation techniques to reduce edema in the patient's ankle. Next is kyphosis, otherwise known as hunchback. The definition is excessive outward curvature of the spine resulting in a hunched posture. Here's an image of someone with kyphosis. This image is also here, but this is scoliosis, which is different. An example of kyphosis is strengthening of the upper back muscles helped address the patient's kyphosis. The next one is vertigo, which is a sensation of spinning or dizziness, often linked to vestibular dysfunction. Dysfunction, not function. So vestibular rehab was prescribed to treat the patient's vertigo and improve balance. This is common in geriatrics. The last one is bursitis, which is an inflammation of bursa, often caused by repetitive motion or pressure. An example is the patient's shoulder pain was diagnosed as bursitis, common in overhead athletes. So this is an example of the shoulder, and here's an inflamed bursa versus a healthy shoulder with a normal bursa. So in conclusion, physical therapy helps people move better, feel less pain, and get back to doing the things they love. Knowing the right medical terms is important for understanding what's going on and making sure each patient gets the best care possible. Through this assignment, I learned how deeply physical therapy is connected to medical terminology, not just for treatment, but also for communication with patients and healthcare teams like doctors. And I really didn't realize how many complex terms are used every day for managing conditions like spasticity or kyphosis. This project helped me better understand the language of my future profession. It made me more confident in recognizing and using advanced and simple medical terms. And also, over the course of this class, my ability to break medical words into roots, prefixes, and suffixes has also improved. And I still want to learn more about terms used in specialty areas of physical therapy, like the pediatrics and vestibular rehab. And I hope to grow my ability to explain complex medical terms in a way that all patients can understand. Thank you.